Hi, everyone. Welcome back to another Arapaho Film MusicConnects concert event. This is another very different show this week. I'm really privileged to be joined by Dr. Julie Link. She runs the Audiology method here in Denver. She works with anybody who has hearing impairments or questions, or just checking your hearing when it's healthy. I've been told is really a good thing to do, to monitor it throughout your life. And so welcome, Julie. Great to have you with us.
Devin, thank you guys so much for having me. Working with musicians is one of my many passions in audiology, so it's really a privilege to be here with you guys tonight. I would clarify, in addition to hearing, audiology is also tinnitus imbalance. So a lot of people don't know that. And when we talk about music and audiology today, a lot of musicians, worry about their hearing, but we also want to develop ringing in the ears or sound sensitivity either. So it's really a wide berth of things that I get to work with different musicians, which is really cool.
And just some musicians that people will probably know who have developed some sort of hearing loss, people like Neil Young, Brian Wilson, Eric Clapton, Chris Martin, and of course, musicians that I'm more familiar with, Robert Schumann, Ludwig van Beethoven. They're all notoriously just hampered in their lives and careers because of tinnitus or hearing loss. So we could get into that a little bit later. But this is actually a great opportunity, I think, for anybody following us on Facebook Live. We're also on YouTube Live, especially musicians out there, or anybody who ever had questions about hearing, or we have the expert right now with us about what instrument is the best instrument to stand in front of, or anything you've ever wanted to know about hearing. So maybe, Julie, just before we get into some questions that I've already gotten from some people, can you just talk about how you found this profession, and maybe how you in your connections with music?
Yeah. So I actually grew up on a farm, which seems a little far off from that music, but it's that noise exposure piece, right? So there's lots of excessive loud noise on farms with the animals and the equipment, and it was all totally preventable. And so when I went into audiology, it was all about treatment. And I really wanted to, and that's why I started my practice, to conserve that hearing, right? So if we can prevent it altogether, that's the best treatment. And if there is loss or tinnitus or sound sensitivity, to minimize that risk in the future. So it's really about empowering people to be able to make informed decisions, right, about their ears. For you guys, your ears are your instruments, right? And so I want you guys to have long careers, and I also want you to enjoy music when you retire, right? So that for me is a really big piece of it. And I felt like that was really missing when I entered the field. So it's been a real honor to get to work with musicians. I am not a musician. I played the trombone in high school.
Oh, nice. I played trombone
you did
too.
Yeah. I think it was like fourth chair or something in like the 5-person section. But either way, it was really fun. I really enjoyed it. I wasn't great at it. So what I tell my musicians is, I'm not a musician. I'm not going to tell you how to do your job, but I would like to make you think about it a little differently, right? Looking at that hearing conservation piece of it too.
So I can just start out before we get some questions from listeners. I can start out just telling you my experience. I spent my formative years sitting in a jazz band with trumpets blaring, right behind me, and then right after that, I ended up standing in front of the orchestra with trumpets blaring on the other side of me, so I could see them. And I did get a hearing test a few years ago, and it was found that my hearing has not been affected at all. And you hear about studies, and there's a Norwegian study that you may be familiar with, where they found that 2/5 of musicians suffer some form of hearing loss, and we're talking about orchestras here.
Yep.
Not like rock concerts where you're standing up by the sound system, which I've been to plenty of those. 3/4 of musicians suffer from tinnitus. And then they recommend an 85 decibel limit. But on the other hand of that, there was a Canadian study that showed that musicians actually experience little to no risk of noise-induced hearing loss because the exposure of an orchestra regularly fell below the 85 limit. Can you kind of talk about, can you weed through the news out there and kind of talk maybe to orchestra musicians, maybe not just the violists or the second violinists who are constantly getting stuck right in front of the brass section, but also maybe violins with the music coming right out their ear, or trumpets who are playing away from them, or horns who are playing behind them, or obviously tubas who are shooting to the heavens. Can you talk about those differences and maybe some of your knowledge from a scientific perspective?
Yeah, I'd love to. And I'm glad you brought that up. So with orchestras, like you said, they are going to be quieter, but because you guys are so diligent, right, and you're practicing, right, so you have a longer exposure. So when we look at noise exposure, right, and we're looking at, shouldn't say noise, like we're looking at sound exposure, right, because you guys don't make noise, make music. We're looking at time and intensity. Right. And so if you are playing right at 87, right, for a longer period where you have a rock concert where it's short and they're not practicing every day, and that might not be true, but you know what I'm saying? You guys are practicing for that longer period. So they do actually find that orchestra musicians are at higher risk because of that. With kind of what you mentioned, that was awesome that your hearing is within normal limits. That's great. We want to keep it there, obviously. So most people have heard of the Osha safety scale, right? It's pretty common, right? But there's also the NIOSH and the WHO. The Osha safety scale, which most people don't know, only protects 75% of people. So in 75% of people, if you're at 85 dB for a certain period of time, right, you're not going to get hearing loss. But if genetically, right, you have heart conditions, you have high blood pressure, cholesterol, you have hypothyroidism, those kind of things, you actually put yourself at a higher risk, right? So compounding those things, or let's say that you play music, but you're also, I know a lot of your guys' musicians, right? This is not their full-time job. And so there are other things that they're doing. I don't know if there is anyone, but say they're managing a bar, right? You have all that noise exposure in addition to practicing, performing, rehearsing, watching other people perform. And so that all adds up. So for you, you might just have some strong ears, right? You were in that 75 that got by, but we don't know who's in the 75 versus 25. And the only way to really know is to get your hearing tested annually, right, to make sure that things look stable and whatever you're doing is working. Because that's our goal, right, is to keep that hearing moving forward so you can continue to do your work and enjoy music.
Great. Yeah. And everybody can see below the audiology, audiologymethod.com is if you want to get your hearing tested. I've done it. It's a great self-esteem boost if you pass the test.
Depends who you are, Devin.
More importantly, if you don't pass the test, you know, and you can start taking precautions to mitigate that. You talked about the time of exposure. I'm also curious about distance. Because you know, like with a Wi-Fi signal, for example, the farther you are from your router, the healthier it is for you. Is that the case? How does that apply to sound?
So every 3 feet, the loudness of sound drops in half. Okay. So yes, if you can put a little space between you, if that works with how the band's set up, then that is going to make that considerably less sound pressure once it gets to your ear. So hopefully that'll keep you safer. So if we can spread that out, reduce the time, reduce the overall intensity, all those things we're looking at, right? Because you guys have been playing for a long time, right? So if I had my way, I would meet musicians before they started playing, right? And we would start talking about these things right away and getting them into protective behaviors, right from the beginning. So they've trained their brains, right, to hear at a safe level. I would say that's not happening anywhere in the world right now. And so now we're kind of backtracking, right? It's like, okay, shoot, now we got a problem. Now we got to fix it. That stinks. Now we've got to mitigate further problems. So yeah, if you can kind of train the brain to get used to it. The good news is when we look at research from Northwestern with Nina Kraus, musicians, it's the hardest to change the behaviors, right? Because your guys' brain is so tuned to all those tiny little changes, but you guys also adapt the quickest and the best. So if you can push through that little bit of discomfort, which you can, research shows you can, then you will have the best outcomes, which is really cool and very encouraging. And I love being able to tell my musicians that, because when they fill out their intake forms, I'm saying, okay, how motivated are you, right, to keep yourself at the level you're at or improve it. And they're all very highly motivated, right? Because they want to continue to enjoy that music. So we look at that and say, hey, this is the good news. You're doing something now when you can, and you're going to be able to do better than most people, which is great.
It seems that because you talked about how 75% of people, that's the amount that OSHA protects, depending on other life factors or lifestyle factors or health, issues that anybody may have. Are there things that people can do aside from, obviously, if you're stuck, in a job or something where you may be exposed to loud noises some of the time? Are there things like, I remember my mom used to tell me to eat carrots for my eyesight. Are there other things that you're recommending for people for oral health?
That's a great question. So the ears are actually the most sensitive organs in our body to oxygen and blood flow. So the more healthy you are overall, right, the more protective, the more functional, right, your ears are going to be. And so I can't say, research-based, right, that if you eat a good diet, you get good sleep, all those things are going to improve, but it makes sense, right? Your brain only has capacity for so much. So if you're exhausted because you had a bunch of caffeine in the morning, you didn't sleep good the night before, right, you're going to be straining more to hear. It's going to be harder to practice, right? And so all those things are intertwined. I don't know how many of you guys that are watching today, have been struggling with the mask, and you're like, I don't have a hearing loss. We all use visual cues, right? That's one more thing that we use to make it easier for us to hear. And so it's all part of that one system. And it definitely integrates.
So when we're talking for orchestras, it's very common, and we have a question that's coming in from YouTube from Cynthia. Hi, Cynthia. It's very common for these plexiglass sound shields to be protecting the string players, which usually form the bulk of the orchestra, and they're encircled by the woodwind and brass players. So the way, in terms of like sound waves work, how much, if you have one right behind your head, but I assume also depending on the size of the room and the acoustics in the room, that you're still receiving a lot of that sound because it's bouncing all over the place.
Correct. I don't know what's your exact question? There's definitely reverberation happening. I would agree.
Yeah, I'm just curious about the effectiveness of those sound shields that, they look like music stands, but they're clear plexiglass, and they sit a lot of times behind individual musicians.
I'm not familiar with that, Devin, but just knowing what I know about sound, that would make it that much more important for that person in particular to be protecting their ears. Right? Because not only is it going out, but now it's coming back to them. And we can talk more, about different things that you can do, particularly in an orchestra. It's hard because you guys are not necessarily going into a mix, different things like that are going to affect how you're going to hear each other and how you have to synchronize, right? Versus just concentrating on yourselves.
Yeah, so maybe we can move a little bit into hearing protection, because I also have a little bit of experience with this. So I would love to hear your thoughts and your recommendations, and I'm sure everybody listening would, or people who will listen. A few years ago, when I got that hearing test, I did get some custom West Tone earplugs.
Local to Colorado, very good.
Yeah, and so they go in and out very easily. That they have little contraptions, you can grab them out. Unfortunately, one of them one of the contraptions broke off. So it's harder to get it out. But I tried it, and I think there's a couple filters in there. One that filters 10 decibels, which is like the minimum, and then one that filters 20 decibels. And I tried it, and regardless of the decibels it filters, it's just so hard I tried it in rehearsal. I think I've only done it in performance with like an ABBA revival band, because that was just so loud. I didn't care about what it affected. I just couldn't. I needed protection. But yeah, I'm curious about how those work, and are those, because it's kind of like when you wear a mask in the times of COVID, it feels like it takes away other senses as well. Like we probably taste sometimes and smell for movement and just to interact with our environment. So yeah, I'm curious maybe about if you have a recommendation on earplugs, and what that's actually doing in terms of interacting with other senses that we don't even think about. Like, why would it be so difficult for me to rehearse with them, even though supposedly it's only taking away 10 decibels, but it feels like it takes away the overtones, the colors, the ability to interact with the orchestra as a conductor.
How long did you try it, Devin? Was it for a few weeks or a couple days?
No, it was on and off for a year or so, like maybe a little longer.
How long was like the longest set of sessions in a row that you wore them?
It was almost a full rehearsal sometimes, so 2 to 3 hours.
Okay, all right. That's part of it. So when we're retraining the brain how to hear, right, we hear 24 hours a day, right? We hear in our sleep. That's why we use alarm clocks. That's why we have fire alarms. Your brain is always, always hearing. And so it takes a bit of time to retrain the brain how to hear. Mm-hmm. And so when people come in and they're like, oh, I want this clean fix, like the eyes, right? The ears are pretty complicated. Actually, we don't hear with our ears. We hear with our brains. So when sound comes in, right, it's a sound wave, and it's vibrating, and it vibrates the eardrum, just like a drum. And then that moves the 3 tiniest bones in our body behind that, like a lever system. And then that lever system moves into the cochlea. And inside the cochlea, just like a piano, right, it's got a bunch of little hairs that are finely tuned. There's 16,000 of them in there, to different pitches. And so those little hairs are inside fluid. And that fluid, I actually do have a prop for this because I thought this would be cool.
Cool.
So as we're talking here now, let's see if I can get a good one. All right, can you all see this, little pipe cleaners? So wow. As we're talking here now, right, it's just going, the fluid's just flowing right over those little hairs, right? And then we're exposed to loud noises, and it's like crazy, right? And it's like, what I like to say, it's going from like seaweed at the bottom of the ocean, nice and easy, to a hurricane, right? This, I'm never, ever, Devin, going to get to be able to use these pipe cleaners again, right? I'll never get them perfectly straight, right? And so now, even if our hearing test looks good, right, we've still got some damage here, right? And we're changing that signal that's going up to the brain forever. And there are some studies they're working on in Kansas and Harvard right now on trying to regenerate these. But this is just one part of the puzzle, right? So you have this hair, and then this connects to your nerves, and then it's going through your cerebellum and, you know, all these other parts. And then we finally get up to the auditory cortex of the brain. Once it gets up to the auditory cortex, that's where it adds the meaning, right? So how long have you been in music, Devin?
Most of my life, probably since I was 7 or 8, really.
I'm not going to ask how old you are, but it's probably been a little bit.
I think probably everybody listening already knows.
Right. And so we're not going to change the way that the brain is going to process that sound for you in 2 to 3 hours. Right? It's just not going to happen. So it has to be that consistent use. A lot of my musicians, when they do hearing protection, they wear it when they're not even playing music, right? Because they're trying to train their brain. Okay, this is the new normal just for now, right? For the next couple of weeks, as I'm retraining it to get used to that. So that's kind of how that ear works and what we're trying to do with musicians, right? If we're having that constant attack on the little hairs, right? These are still here, right? They aren't gone. Maybe a rock concert, we lose a few, right? So they're still there. They're still functional, but they're not going to be sending quite as succinct of information up the nerve to the brain. And so we're trying to keep those as clean as we can and as intact as we can too.
Does cleanliness have to do with wax, or do you recommend that people clean their ears in any form?
I had a friend, her little brother joined the military, and their family all sees me. They all have a bunch of earwax. And I looked in there, he was totally plugged up. And I was like, I almost don't want to remove it because it's protecting you. It's an earplug, right? In his ears. But I wanted to get a good baseline before he went in case he needed it later when he left the service, all the baseline testing we could get out to beyond the speech frequencies, right? So when I work with musicians and people going through chemotherapy, I test out past just 8,000 hertz that we need for speech, and we're going out to 20,000 hertz, right? And you guys are very sensitive to that. And it can tell us sometimes when we're noticing changes before it affects the speech, the things that we're relying on for the music, right? And so it's kind of a nice way to measure a little further and kind of talking about your baseline, right? Did they do a test called OAEs where they're actually measuring these little hairs? It feels like my little bouquet here. To see.
Thank you
how
for bringing props, by the way.
Thank you. I tried. A little sign in the back. To see what that looks like.
Those bring me back to like 7th grade or 6th grade art class. I haven't. Right? I feel like I haven't seen them in decades.
I thought add a little color, a little something. I love talking about it, so I thought we could do a visual with it today.
It's beautiful spread.
If they've been playing with earwax for a long time, like I'm going to take it out because I need to baseline them. But sometimes I'm tempted to leave it in because I'm like, there's a built-in earplug. They got used to it. I mean, if it's a lot of earwax, it's a significant plug that they've been playing. And I'm like, oh, this is kind of perfect.
Wow, so that's good to know.
I always do take it out, but that actually sometimes can actually help them.
So you recommend maybe not Q-tips, just like you're in the shower, use your pinky kind of thing.
Did I talk to you earlier? That was spot on. Exactly. So if we think
I don't know. I think I've seen it some other place, I think.
So if we think about how the ear canal works, sorry, I'm trying to get myself on screen. Our ears build wax out here in this outer portion, and this part's cartilage. So when you chew and you talk, it works its way out. But if you use a Q-tip, you'll get some, right? But then you'll push the remainder of it back here. This part back here is bone. So when you chew and you talk, it doesn't move and it gets stuck. And it's a lot less comfortable to remove there than on the outside. Some people, it just gets stuck naturally, like my friend, her family. So they come in, but it's all fresh and on the edge. Sometimes hers just falls out on her at work. It's the best. That's how it's supposed to work. We want to have wax. It keeps bugs out of our ears. I've only found bugs in very clean ears. So we want to have that there. Plus it's taking out the dirt and the debris, right? And helping it get out. So we want to have a little bit in there for safety.
I have a really kind of gross story, but I don't know if I
maybe for everybody else, probably not for me, the farm girl, the audiologist, right?
It has to do with spiders. Do you want me to share it? You're the guest.
Yeah. Let's talk about spiders.
An EMT doc I know who kind of shares with me some of his more out of this world cases. A guy I think had slept in the wilderness or something, so he had been complaining about pain in his ear, and he came into the office and so if you have any spider phobia, tune out, put on mute for the next minute. And so he came in and they kind of went in there, and the spider had laid eggs. So all these baby spiders just all over the operating room floor and everything.
My worst nightmare. No.
So be careful when you go to sleep in the woods, I guess I should say. So we have a comment.
Human eat like 8 spiders a year or a lifetime or something.
Oh yeah.
So if they're going in your mouth, they just as easily could go in your ear, right?
Yeah, the mouth is just protein, but the ear, that's a problem, right?
Exactly.
So
there's no way out.
We have a comment from Dave. Hi, Dave. Thanks for the comment. He says he uses West tones. The only time he uses them is when he plays in a rock band. He just can't hear with them. So that would be, you answered that question. Sleep with them, eat with them, wear them for a few weeks, get used to them a little bit.
The other thing too, for both of you, the deeper those molds are, the better control we have of it, and the less it's going to feel, like you said, like you're losing all these other senses. So definitely want to see an audiologist that specializes in musicians. There's certainly a few of us here locally, and if you're watching from somewhere else, a lot of us are part of the Gold Circle, so we've been specially trained to work with musicians so that we can make sure, again, you guys can keep doing your job. We're not trying to make it hard. We want to make it as easy as possible. The best kind of hearing protection is a protection you will wear, right? And so the better we can do at making that specific for your guys' needs, the better. So when we look at the West Tones, what you guys have, those are silicone, which is exactly what we want. We want the softest silicone, though, that we can get. And so that's step one. But step two is when people come in, they say, hey, I need this protection. I need to put a piece of foam or a piece of, what is that called? Oh my gosh, styrofoam in my mouth. That's what they told me to do. I'm like, I don't want you to put styrofoam in there because you're not going to play with styrofoam in your mouth, right? So I want you to make the face. I want you to play, right? If you want to get serenaded all day, be an audiologist that works with musicians, right? So they're there getting their ear impressions taken and
free
singing
concerts.
to me. Yeah, I had one patient.
They pay you to play for you.
Exactly. And they hate it because when we're getting the impression, it's not filtered at all, right? So it's totally deaf while they're doing it. I'm like, don't worry, I'm not going to judge you. They also sound way better than I would even without my ear plugged up. But that's part of it too, is making sure you're doing what you're going to be doing in those plugs. So plugs are one thing, right? But it depends what kind of music you're doing. So a lot of people who are in the orchestra, right, they are using filtered earplugs. So there's foam earplugs. Most people are familiar with those. You're going to get a much bigger cut on the highs. If you've never heard of a filtered earplug, what that is, it's got a little filter built in there to try to flatten that response. So instead of getting this big cut off in the highs, trying to make that flat. Again, how that's made plays a big role in how you're going to accept it. I had one patient little side note, who works in the oil industry, and she had to start going out to the field, and she kept looking for the highest level of protection, right? Because she did not want to lose any more hearing. I told her, if you get the highest level, you're not going to be able to hear any conversation. You're going to have to take it off. And then it's going to be pointless, right? So you want to get just the right amount. How do you know? Again, you go back to those scales. How loud can you be for so long? But also that you're going to tolerate. Go ahead.
Oh, no, you want to finish?
Yeah. And so that's one way to do it. But a lot of people, it's too isolating. Like you said, Devin, you can't hear anything. And so they'll move into in-ear monitors, which we would talk more in a session, you and I don't know if that would work for you. But so what that is,
I'm just trying to get a free session out of this.
I know, right? I was like, oh, let me think about that a little bit more. So what we're trying to do, instead of having a wedge, right, is putting that sound directly in your ear. That a lot of musicians think that is protective. It's not, right? So now it's right next to your eardrum. So if you crank it up, boom, we're going to have a lot of music-induced injury. But if we do a silicone plug, right, and we think about, okay, what's comfortable, and then let's just turn it down a notch and play Here for Today, right? What's comfortable? Let's turn it down a notch, right? And it takes, again, a few weeks to get you there. What they found is if you use a wedge monitor, you can start it comfortable, turn it down a notch, 2 dB. The human ear can hear a change of 3. If you're using a well-fit in-ear monitor, you can turn it down. 6 is on average, but some people are able to turn it down 12 dB. It's huge. It gives you hours and hours and hours more time to be able to play safely if you can train yourself to do that.
Do you find a difference? Do you find a wider spectrum and capacity, or any kind of higher level of hearing for musicians in general, just because of the act of being a musician?
Yeah, so Nina Kraus was at Northwestern in Chicago when I was at Rush in Chicago, and her research based on musicians is fascinating, and I recommend to all of you that are nerds like me and Devin that you go and seek that information out. And what she found was your guys' brains are so much more plastic, right, in the auditory cortex, that you guys do so much better with managing it when you put your minds to it, right? And with treatment when there has been damage that has occurred, because you're able to adapt. It hits you like a truck, but you're able to bounce back from it so much quicker than untrained. I have a colleague of mine, actually, she has a practice in Texas, and she's doing music training with all of her patients. So she's training them to become musicians as part of the treatment of hearing loss. So I am excited to see the research that she's able to produce with that. It's pretty amazing.
Can you talk a little bit more about in-ear headphones versus over-ear headphones, or are no headphones good? And maybe just more specifically, something like the Apple AirPod Pro, where actually they have a mode where it enhances the hearing, right? Like, so it acts as a microphone, and actually some people, I think I've heard that some people can use them in social situations if they're trying to hear someone right across the table. Maybe just talk a little bit about those. Are they dangerous? Are they safe? Are they good?
Yeah, so if we look at personal listening devices, like you were talking about, outside of using it to hear yourself when you're playing, when we look at even earplug use, anytime it's going to go inside your ear, there's a greater risk of user error, right? If you have a muff and it's big enough, not like these little cups, but a big cup, it's harder to mess that up, right? And so if you pop that on, there's a chance that you're going to get a pretty good seal. Versus if you just have a non-custom piece you're going to throw in there, like a foam earplug is supposed to give you 30 dB. I was just looking at some research today, getting ready for our talk. Supposed to be a 30 dB reduction. Most people, when they put it in, they're getting like 11, right? And so not knowing how to put that in properly changes that outcome. So that's one piece of it. So it's okay, but you have to get it in. I see patients and I recommend foam earplugs to them all the time, right? It's not musicians, obviously. And we practice. I say, okay, let's demonstrate to me that you can do this. And if you can't, then we're going to go a different direction. As far as the AirPod Pros, I'm excited, super pumped for that to become, they're going to have an update. I think it's iOS 14, where they will become amplifiers. What will be interesting is, in order to, again, keep that auditory cortex stable, we hear 24 hours a day. Right now, we can't wear hearing devices 24 hours a day, but we have to wear them at least 12 to keep that auditory cortex up and running like it's supposed to, so we don't continue to lose hearing and put ourselves at risk for dementia. And so there's a battery power problem. And then there's also having your prescription. So having to be able to hear soft, medium, loud sounds of speech naturally, comfortably, without doing more damage. And so it'll be neat to test that and see how close it is and how much we can actually adjust it to be able to preserve hearing for people.
Can you talk about, in terms of pitch? It's my understanding that as people get older, you lose the higher pitches. Does that happen with everybody? And is that correct?
I'm so glad you mentioned that, because to tell everyone else, I was slacking. I didn't send you my bio. So my average patient age is under 50. Most people don't realize that the majority of people with hearing loss are under the age of 65. It's just a gradual thing, right? So we don't go to see the audiologist every year like we do our dentist, our optometrist, right? And so we lose it, but we compensate really well, right? We're humans. We communicate. That's how we communicate with people, is through talking. And so we do good until we don't. And then there's been so much damage done by the time it gets diagnosed, right? It makes that treatment a lot harder. So if we look at the blue zones in the world, I think I can't tell you exactly where they are, but basically these people are living well into their 90s, extremely healthy. As a community, they don't really experience hearing loss. So we know that when we have hearing loss,
a lot of bacon, maybe.
What's that?
They eat a lot of bacon.
I don't think so. I think it's a pretty Mediterranean diet, but who knows? Maybe they have some pork there. I grew up on a pig farm, so I hope so. Yeah. So we know noise exposure, right? I think a lot of people think of that, but there's also heart conditions, right? I see a bunch of patients that have had kidney issues and hypothyroidism and high blood pressure and diabetes, right? So those things tend to happen as we age, right? And so, but if we take those things out, like we do in the blue zone, we don't see nearly as much hearing loss. And so that's, to me, is very motivating to try to help people prevent it. Kind of going back to like what you said, is there anything we can do to keep our ears fit besides wearing hearing protection? Yeah, be healthy. And that seems to really protect your ears too.
There's some study, I can't remember what it was, but it was tracking the register of notes of Beethoven's through his compositional output. And it seems as he got older, the notes he used went lower and lower.
Oh, that's interesting. Well, and
So
we know, he had, limited hearing. Yeah, it just kind of depends. And also, if we look at some of those conditions, right, they're going to affect some of those higher frequencies. So did he have diabetes or, I don't know if we know. So maybe some of those other things were contributing to, or loud noise exposure.
Well, as long as we're on it, I just went ahead and listed some of his, some of the things they thought were the cause. Some of his potential causes of death were syphilis, lead poisoning, typhus, and also he would plunge into cold water to keep himself awake. And then Beethoven also thought that in his diaries and his conversations, he thought that his hearing loss specifically was either caused by when he was 26 or something, somebody interrupted him working, and he went into a fit of rage, I think, and banged his head. And he also thought that it could be his gastrointestinal problems, which, I mean, and that Beethoven talks about that a lot throughout his life, and a lot of his other ailments probably relate to it, which is what you were talking about. The body is like a holistic thing that is interconnected. But yeah, I just wanted to throw those out there to see if any of those kind of, rang a bell in terms of like, oh, that could be what did it.
Off the top of my head, we don't see as many of those, in the day to day as we probably did back then.
You don't see that many composers, any famous composers.
Well, I just meant like, what'd you say, typhus? Some of those
lead poisoning. You're right.
Yeah, I just don't see that in the clinic as frequently, but it would make total sense with how the ear works that would have occurred. Or like you said, the head injury as well.
Yeah. Let's go to movies. It's not something we have to think about in COVID times as much. But something that I've always done is, I think it started when I was a teenager. I was like, gosh, this is so loud. And I crinkled up napkins and put them in my ears. And now, of course, I have my West Tone earplugs that I use more when I go to the movie than I do at an orchestra concert. But I'm just kind of curious, like, are there regulations in place, like, for that kind? Like, you would think when there would be federal regulations that a movie can only get so loud that it's not harming, at least 75% of the population. But is that something that people should be doing when they get, like, a simple act of going to an action film?
Yeah, I think so. There's I'm trying to think what it's called. There's a free app on your phone. It's called NIOSH, I believe.
And the watch does this now too.
And I was just to say, I've been mostly talking about the watch. So I love the Apple Watch 5 feature, where it's going to tell you what your decibel level is. So you can go to the NIOSH scale, the Osha scale, the WHO scale to see how loud it actually is in the movie theater in. Or there's a cool new app. I wanted to start this when I started my practice a few years ago. My website designer was like, this is not included with your fee. I was like, oh, okay, that makes sense. Anyways, it's called Soundprint. And so you can look up restaurants, and I would imagine in theaters and things too. I haven't looked specifically. I'm going to check after we're done today and see how loud they are. So other patrons have already recorded it. So you can be ready. You'd be like, oh yeah, that thing is loud. I better bring my earplugs with me so that I'm ready. I'm a big proponent. I've got earplugs in every single bag, everything that I do. Yeah. I treat it like sunscreen, right? So it's always on me. So I'm always ready. So if I'm in a situation, I've got them, I can throw them in. And I have all different kinds, the filter, the foam, whatever, just so that I'm always ready in case that occurs. And if I'm not quite sure, that's when I pull out that app or look at the Apple Watch to see if I need to be protecting it. It's always better go on the safe side, but if you're not sure and you don't want to use a plug, then using those resources is really helpful.
So we have a few more minutes, and a few questions have been coming in. So somebody wants to know about Blue Zone again, and that's pretty. That's just parts of the world where people live a very long time. So scientists
and a healthy
flock
time
there.
too. Yeah,
and a healthy time, yeah, and they don't kind of experience the Western aging that is more familiar with our way of life. And so scientists flock there to see what they're doing, right? To see what we can do. Yeah. And they all share the common trait of bacon. That's not scientific.
That's only for this happy hour. Yeah.
Happy hour bacon. I like the sound of that. Okay. And then, so we have, is there anything you can do with tinnitus? Is it tinnitus or tinnitus?
Either one's correct. I always say, if I can influence you, I like to say tinnitus. It sounds a little less scary.
Okay, yeah, you're right. So is there anything you can do with tinnitus once you have it?
Yes. So with tinnitus, there's actually, I just took a whole course on this last week, virtually. And 34 million people in the world, or in the US, experience tinnitus. Only about 2 million are actually bothered by it. So it's, it's a reaction of the brain, right? It's not your ears saying, something's a little different. And if you don't have any meaning for that, right, it's like, what's going on? What's this new sound? And your brain's always thinking about it, trying to place it. And so there are therapies that some of us audiologists specialize in to help you become, the other 32 million that aren't bothered by it. It's a very livable condition. It does take some time to, again, just retrain the brain to understand that in a different way, to assign a different meaning to it so that it's not in your focus all the time.
And of course, famous composer Robert Schumann, who was 1810 to 1856, had experience. I mean, we think he probably got syphilis at an early age, and he died he went insane. He committed himself to a mental assignment. But he recounts of hearing, he would use tinnitus in the end of his life to compose, and he lost his mind because he couldn't control it anymore. But he described it as angels and demons singing to him in the key of E flat major.
Very specific.
Yeah. So it can get colorful, I guess. Yeah,
when I was at the VA, I saw a lot of veterans. So that's the number one service-connected disability at the VA is tinnitus. And the first one walked in and was like, I hear the Star Spangled Banner. I was like, oh, that's interesting. Wow. And then I kept hearing it, and I was like, okay, so that's how it manifests for them. Some of my musicians hear music, other people hear crickets, white noise. It can, again, it's whatever the brain wants to make up for that information.
Yeah, it's funny how because as a young musician, or when I was starting conducting, I was also composing a little bit, and I would read about these things about Beethoven or Schumann hearing these angelic voices, and I would ask, why can't I?
Right.
I'm open. So
I have patients that use it as part of their meditation. So you're right; it can be a tool.
That's cool.
Yeah.
And then we have one last question, and that's: can hearing loss lead to dementia?
So there is no direct correlation, right? So if we look at the studies by Frank Lynn in Maryland, John Hopkins, right? Yeah, that's Maryland. And when we look at that, and there's a really nice Lancet study that's, I think, 2017, and it looks at the risk factors for dementia. And what they find is hearing loss is the most controllable risk factor of all of those. So the brain can't understand what it can't hear. It can't remember what it can't hear. So it never got there in the first place. You're probably not going to remember it. But also, we only have so much mental capacity. So if you are working really, really hard and straining to hear, it gives you less to be able to take back and remember. So you might remember it for a moment, but then it might be gone. So we think at this point, again, it's not definite causation, that has something to do with it. And so there's some studies, again, it's pretty fresh research. I think this all came out in like 2015, so it's pretty new. And I think one of my patients sent me an article looking at possibly, reducing it. But again, there needs to be a lot more vigorous study and a lot more time before we know for sure.
Well, that's great. And Dr. Julie, thank you so much for joining us and all this incredible information. This is gonna be archived on Facebook and YouTube until we all turn 90 or 95 and create our own Blue Zone. And I just wanted to shout out to all the subscribers and donors and audience members and YouTubers who participated in our spring campaign. It just came to a close. We were able to raise well over our goal of $25,000 with matching donations. So thank you so much, everyone, for being a part of that. If you weren't able to donate or you just heard about it now, you can very easily text to donate 44321 or go to our website. You can be a contributor once a month for $10 or $5 a month, whatever you can afford. Everything that you give will allow us to keep not only the music going, but really cool programs and having fabulous guests like Dr. Julie joining us. And again, thank you, everyone. And join us next Tuesday, the same time, 7 p.m. We've got the Unfiltered Woodwind Trio, have some really great music and some surprises for you as well. So again, Dr. Julie, thank you so much for joining us. And please go ahead and your website is audiology.com, audiologymethod.com. There it is.
I put the in there before I was thinking. Now I'm a better business owner, but yeah, so the audiologymethod.com. Thank you guys so much for having me. And if you guys have more questions, I feel like I didn't cover an eighth of the things that I was hoping I could share with you guys tonight. So if you guys have more questions, please send them on to Devin, and I'm happy to get those back to you guys.
Check her out, and we'll send this to all our musicians, and hopefully you'll receive some inquiries first.
If you guys just take better ownership of your ears and have a long career and enjoy music the rest of your life, then we've done our job.
Thank you, Dr. Julie.
Thanks, Devin.